Hi, my name is Lillian Barker, and my presentation is on my business plan for a LIFT team program. Hospital workers suffer work related injuries at nearly twice the national average rate. The cost associated with the nurse turnover can cost an organization up to $103,000 per nurse. A workers' compensation claim, including wage replacement related to patient handling, could cost $15,600 per claim. LIFT team programs could decrease patient handling injury costs by as much as 80 to 90%. Plantation General Hospital recognizes the need for a new lifting program which will be in alignment with their mission, vision, and strategic goals, which includes building volume for the bariatric program, which started in January of 2015, decrease length of stay, maximize value-based purchasing, improve safety and quality of care, retention and recruiting of nursing staff, and enhance marketing campaigns. A 10 hospital study using lift teams led to a 70% reduction in injuries and 90% decrease of lost days. A 6-year study demonstrated a 90% reduction of injuries and a 99% reduction in cost. Indirect cost benefits associated with introducing a lift team include reduction in pressure ulcers, increasing nursing satisfaction, and increasing patient and family satisfaction as well. To begin planning for the LIFT team at PGH, an interdisciplinary work group will be formed. The team will test equipment from various vendors. Members of the LIFT team will be recruited internally and externally. The selected members will go through an extensive 2-week training and orientation. The LIFT team will be utilized anytime a staff member needs assistance moving, turning, lifting, and transferring a patient. Aside from the on-demand and scheduled appointments, the team also round in the ICU every 2 hours to provide turn and lift assistance, which will decrease the risk of pressure ulcer development. The program will be offered 8 hours a day for 5 days a week from Monday to Friday. In doing the market analysis, it will maximize the value-based purchasing power of the organization. It will improve retention and increase marketability of the organization in recruiting new staff. It will also increase marketability of the bariatric program, which started this year. Bariatric Center of Excellence will translate to a 1.6 million additional profit per year for the organization. In doing the SWOT analysis, some of the strengths identified were to increase nursing satisfaction, patient satisfaction, translating to HCAHPS, reduce employee injuries, reduce workers' compensation costs, increase patient safety, improve quality of care, reduce preventable injuries to staff and patients, reduce staff turnover rate, and new pathway for an entry-level position. Some of the weaknesses would be the budget constraints, allocation of additional FTEs, limited funds to purchase necessary equipment and supplies, lack of the training program, retaining employees and turnover, day-to-day accountability, and nurses becoming too dependent on the lift team. Some of the opportunities identified is the increased volume of bariatric patients, improve recruitment of nursing staff, increase the value-based purchasing, and going for the clinical excellence recognition when the bariatric patient volume increases. Threats would be there are other 4 hospitals in the area that offer bariatric surgery. One is actually a comprehensive bariatric program, and it will not be supported by the HCA division and corporate leaders. Initial program startup costs would include operational budget, the salary and benefit cost to provide 8-hour coverage 5 days a week for 2 FTEs. It was calculated to be $49,920. In-house 2-week training program cost, including the educator cost, would be $2,000. Capital budget would include the equipment, the buying of the 3 new lift equipment, which will amount to $6,900. Other supplies needed, such as the lift swings, slider boards, and slide sheets, amounting to $1,500. Cost of maintenance for 2 years is estimated at 5%, amounting to $345 for a total startup expense of $88,445. The timeline for this program would be it would start with a meeting with the senior leadership for approval, going to the MedExec and Board of Trustees, which would take about a week, and meeting with the vendors, finalize the purchasing of the equipment and the supplies, and meet with a work group and do a final preparation, and then start the recruitment and work on the policies, meeting with the work group again before the pilot. So from start to finish, from the approval to the pilot would be 3 months. And after that, there will be a continued staff education, data collection and analysis, meeting with the work group and update them with the progress of the program. And it's going to be rolled out after 4 months. To hospital wide. And then the most important process is really the evaluation of the program and presenting the outcomes to the stakeholders of the organization. And that's the end of my presentation.